Welcome to the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation and the OVS Announces channel. Today's episode is Unbiased Deep Sequencing Analysis of Acute Infectious Conjunctivitis. Today's topical editor and host is Mika. Today's topical expert is Kuniyoshi Kanai. Now, on with the show.
Okay, welcome everybody. In this episode, we're going to be discussing a paper that looks at pathogens in infectious conjunctivitis. I'm Dr. Mika, and our guest expert for this episode is Dr. Kuniyoshi Kanai, who is the residency director at Berkeley Optometry and chairs the Academy's Fellowship Engagement Committee. So welcome, Kuni.
Thank you, Mika.
So this article you should be very familiar with since you are the first author on it, and you picked a very
That's correct.
title. This title is Unbiased Deep Sequencing Analysis of Acute Infectious Conjunctivitis in an Ambulatory Eye Center in Berkeley, California. That's a long title.
That's long. That's right.
Okay, but this was published in the Academy's journal Optometry and Vision Science. So this paper is showing data from the Scorpio study. Scorpio stands for Seasonal Conjunctivitis Outbreak Reporting for Prevention and Improved Outcomes. So what's the goal of this patient series?
All right. So isn't it a catchy name, Scorpio?
That's a good one. That's a good one.
Yes. And so the paper that we published on the OVS is, as you can clearly tell, that this is a small batch of this case series from the much larger clinical study, the NEI-funded clinical study. And the sample size was very small because this is the actual first batch that came out of the Berkeley site. But we thought that the finding was very interesting, so we decided to publish. And the larger goal of this Scorpio NEI study is to really identify the cause of infectious conjunctivitis, which is the bread and butter for eye care provider, optometrists and ophthalmologists across the world. And typically, diagnosis of conjunctivitis is made clinically without the confirmation of the lab testing, and aside from the certain disease, particularly the STD type of related problems. And assumption is that the most of the conjunctivitis is caused by the virus, and particularly the adenovirus. But the question is it right? Is it wrong? Or we will figure it out.
Okay, so one thing that you mentioned in your paper, which you alluded to just now, is that we use PCR testing to determine pathogens, but it's limited because we only order PCR testing as optometrists when there's a high level of clinical suspicion of a particular pathogen, and then the answer you get is yes or no. If it's no, you don't get to know, well, then what is it? So in this study, you did something different. You utilized deep sequencing, so you were able to determine any pathogen. Is that how that worked?
That's right. That's really the core of this study. In a traditional diagnostic scheme, clinician has to have some insight into the case and suspect certain pathology, and say that if you have this chronic conjunctivitis, and somehow you suspect, this may be still the adenovirus, and you want to do testing, maybe you can do it in a rapid test, those home kit test or the clinic kit test, or maybe run the PCR. I doubt that the after weeks of those conjunctivitis, if it actually comes out positive, but say you did it. But if you didn't suspect that this wax and wane conjunctivitis actually could have been something else, we may miss the chlamydial conjunctivitis. So it really, the traditional diagnostic scheme really heavily depends on the clinician's insight and the competency and proper history taking. So in this study, we use deep sequencing. This is the emerging diagnostic tool. And this is just not limited to the eyes, and also used in systemic infection too. And analogy that I usually make is the deadline investigation. And dateline investigation, oftentimes investigators collect a sample of evidence from the crime scene and extract the DNA. And at that point, the investigator may not know the actual suspect or the actual person who actually committed crime. And they run the DNA sample through the federal database called CODIS and eventually identify who did it. And this deep sequencing is somewhat similar, or in many ways is really similar. RNA fragment is extracted from the sample that we collect and goes through this reference check. And the database is called GenBank. And GenBank is actually operated by the National Institute of Health and Genetic Database. And if there is a known human infection, then it hits. So in this case series, we did actually made several hits that we didn't expect.
Right, because, what we always learned and what I still teach is when it's a viral conjunctivitis, it's going to be adenovirus, right? So you had 7 patients. So how many of them were adenovirus?
Only 1. And when I had a chance to actually look at the actual record of the clinical encounter, in many cases, the clinicians suspected the involvement of a virus. May not be specifically adenovirus, but most of the cases were labeled as the viral conjunctivitis. But it turned out to be 2 cases were Haemophilus influenza. They are bacterial. 1 case was chlamydial. And then 1 case was very interesting that we caught the coronavirus 229E. This is not a COVID, but this is one of those common coronavirus that run in the community.
So the other thing that was very interesting in this study to me was, we also learned general rules of thumb to help us determine if something is viral versus bacterial. And this has a lot to do with some of the symptoms the patient has, but also the signs that we see. And I see that your patients or your study participants broke the rules a lot.
That's right. We learned that the viral conjunctivitis patients will have more of a watery discharge. But guess what? Some patients have more of a purulent discharge, mucus discharge. And some patients with the bacterial infection had concurrent upper respiratory infection too. So in the end, we just have to be, as a clinician, open-minded to look for different cues for the diagnosis.
All right. Well, I really like this paper, and I'm very interested to see what else you folks discover. So what is next for the Scorpio study?
So besides identifying the pathogens across the world, we are also looking at how the adenovirus genome evolves. And there's a trend across the world. And just like influenza, we may see those trends. And also we are looking at the human immune response when the patient has only conjunctivitis, and how the immune response differs from patients with the corneal involvement or patients with the upper respiratory infection involvement. So we will see those. But right now, we are still recruiting patients as a group across the world. We have about 800 cases collected already. We're shooting for over 3,000 cases. So if you have any conjunctivitis patients, please send those patients on our way.
Will do. Can't wait to see what else you folks find. Thank you very much, Dr. Kanai, for joining us today.
Oh, thank you for inviting me over.